Today is all about Voice Found. This organization is doing incredible work. Can't wait to tell you all about all the different aspects today. Carrie is joining me now. Carrie Whitley is here. Hello.
Hello, hello.
Thank you so much for joining us
Thanks
here
for
on An
having
Hour
us.
to Give. We have a whole hour to tell everybody all about Voice Found. Your particular area is so fascinating to me. Give us a sense of what you do for Voice Found.
Okay, so we have a primary care clinic. There's 2 nurse practitioners. So one supports the Strength Found program, and you'll meet them later. And I support more the human trafficking side. So work hand in hand with Sarah, who you just met.
Yeah.
And we provide primary care to anyone that kind of fits the qualifications to come in and be seen at our clinic.
Okay, so how did you get into this line of work?
Yeah, so way back when, I started as a nurse at Sexual Health, worked at the Civic, and then worked at the Mission for years with Inner City. So did a lot of trauma work, a lot of trauma-informed care for men mostly, outreach to women's shelters, and then during the pandemic I was looking for a change, and me and Cynthia met, and it was match made in heaven.
Yes, and we're going to meet Cynthia later,
Yes.
and everyone's going to understand that even more when they meet her.
Exactly.
She really is inspiring for sure. So give us a sense, somebody coming into the clinic for the very first time, why is someone coming to the Voice Found Healthcare Clinic and not a normal clinic?
Good question. So being trauma informed, we start with our first contact. So we help people Uber in. It's an appointment only clinic. It's not publicized where we are. So it's very safe, very private. These are people that often didn't seek health care or might have been a bit traumatized by the regular healthcare system. Lots of poignant questions, maybe people that aren't always trauma informed or don't have the time. We can have hour-long visits. We greet them with, choice. Would you like a coffee or tea? Would you like nothing? We start that process of empowerment from the moment they walk in, and trust. So we have all the time in the world. No one's paying, we're paid to do this care. So we focus the first few visits on trust unless there's really pertinent needs, like someone was assaulted and they need to be taken care of, need infections taken care of. We have a range of things from autoimmune disorders, which are higher in people with a higher adverse childhood events or ACE score. And we have people that are just there for regular like sexually transmitted infection testing because they're still actively working.
Wow.
So very varied.
Very, and I can see why a regular clinic would not suffice, right? I mean, you need something very poignant, very secure, safe, the trust piece. And normally we think about going to the doctor. If we get 8 minutes with our doctor, we're very excited to just be able to talk about one issue. This is very different though, right, Carrie?
Very different. And I think because we're able to offer this trauma-informed care, we do get a lot of people applying to be clients with us that sadly, hopefully one day we get funding and we can offer it to more people, because 1 in 4 have been sexually assaulted. Like, we could really serve most of Ottawa, but right now we do have to stick to the funding right now. But yeah, it allows us to really give comprehensive care. And I think the best asset I have is connections like Sarah, like Lucy, who I can be like, I'm going to take care of your health. I'm going to help your mental health. We're going to start you on medication. We're going to wrap around your services, but then you're going to have this support for the other things that I'm not a pro at, like getting housing. And I do a lot of Ontario disability applications and that kind of things to support financially, because then hopefully they don't have to work as much. But people will come in talking about their boyfriends, and I'll, get that little highlight in my stomach that says, okay, this isn't a regular boyfriend, and we'll model healthy relationships to them, which I think has been really important.
Wow. I'm a very visual person. So the visual image that I got when you were talking is just this one beautiful blue door. I'm picturing the colors of Voice Found. I'm picturing a door that they can walk through and everything's there. When I think about, not to diss on healthcare, but when I think about healthcare, I think about all these different doors you've got to go through to get all of these different services, where there's this one door that opens and there you are.
Exactly. And they actually greet Katie, who's our receptionist, who is like the picture of kindness and sweetness. And she's so great at booking them in, making them feel welcome. My office door is right there, so it's always open. They often just sit on my couch. I'll do their blood work on the couch. We'll talk about everything. We'll go over their old files. And if we need to do an exam, we have a big open space with 2 doors, so there's always an exit, so they feel safe. I'm able to do their blood work, their pap smears, IUDs, all their, birth control needs. Yeah, after we've developed trust.
For sure. So, and you've mentioned trust. Sarah's mentioned trust. I mean, I don't know because you're the expert, but I would think trust is the core of trauma-informed care.
Exactly. And it keeps them coming back. So, Carrie, I misused the drugs you gave me. I want to be honest with you, and I need help with that. Absolutely. Obviously, we need a higher dose if you're misusing them. There's no judgment. There's no, you missed your appointment, we're not going to see you for a month. It's, hey, I got something open tomorrow. Hey, how about I call you? Sometimes we even go to their homes and meet them. So building that trust where they might not have had it before. We're not 8 to 4. We're 24 hours, and my poor partner knows this. Phone's always on. On vacation, that's usually when the rings start. And sometimes I take them, and sometimes I know when they can wait. But people trust me to help make that decision for them.
Right. Yeah. Would you do anything else?
Oh gosh, no. And I'm 3 days a week at Voice Found. It's heavy work, so I'm very connected to my clients. But I love the healthcare we can provide, and I really feel a lot of autonomy in able to do this. And our team is just beautiful. It's so supportive and kind and. Yeah.
One thing that I keep thinking about, because of course I read the paper and listen to the news, and the strain on emergency rooms right now, and I keep hearing this little bird say to me, Voice Found's a solution. They're actually taking the strain off emergency rooms. Am I right there?
You're very right. Okay. And sometimes people will be referred to us through the sexual assault center, and they rarely have to go back, or through CHEO. So I'm able to keep most people out of emergency rooms. I would say 90% of our clients, sometimes they get anxious and they want to go. And after 6 hours, they come back, But we can get them in rather fast. We have emergency slots always open for new exits of human trafficking. So, and one of my favorite clients, who's now the first in her family to do a university degree. She's doing a psychology degree. She's amazing. All my clients are favorites. But she said to me once, why did I go back to Emerge 10 times with different broken bones? Why didn't anyone say anything? Why didn't anyone speak up and reach out to me? And that's what our organization is doing. I go to healthcare providers, say, these are the signs of human trafficking. Right. I try to help med students, NP students, paramedics, anyone that might have a first contact that just needs to say, here's a card, here's someone that can help you.
No, that something was not on my radar at all. Because, you think about going to med school or nursing school, I mean, you're learning so much, but this is a whole new level of identifying what's actually happening to somebody, right?
Exactly.
Yeah, wow.
And I didn't learn that in school either.
Okay.
And I think it's one of those things we don't know until we know. So really spreading that word. And one of our peer supporters goes and talks to grade 9 students. And my kids in grade 9 said, wow, Mom, there's a lot to do here. And they start to identify, that person might be at risk. They don't have a lot of friends. They hang out with kind of an older person, and you start to get that feeling and know when to call for help. And
it's that whole thing. I can kind of hear my mom, if something feels wrong, it probably is wrong, right?
Exactly.
And so often we push that down. Oh, we don't want to get involved, or we don't want to say anything. I think that's turning. I think people are like, nope, I see something happening with a student in my class, or I see, something happening with a coworker, and I think we're speaking up more. I'm hoping we are.
I agree.
Yeah.
Yeah. And it's really like, I definitely had a bit of a bias coming into this work, who I would be seeing, because I've worked with people in the sex trade for years and years. This isn't the typical client. It's a very young, vulnerable girl who's looking for attachment, looking for love, looking for someone to care for her. And it can be any age, it can be any gender. This is generally what we're seeing. So,
did the pandemic make things more difficult? I know you sort of came in during the pandemic, but do you think that was a time where people were even looking for more connection and they were kind of trying to find it anywhere?
yes, and things went online. So there's a lot of, and unfortunately the online acts had to be brought up a level. So that increased the risk a lot of times for our clients. And the outreach services stopped. So they were often closed down. We didn't close, thank God, and we kind of couldn't wear masks because it was too triggering for our clients. So we were able to give full care throughout the pandemic, but we're just a small organization. And a lot of the outreach organizations, people did struggle with getting help.
Well, now I'm convinced you've got angel wings and we just can't see them. That's incredible. I mean, to be able to do that in a pandemic, and when so many people were feeling alone and vulnerable people, many unfortunately fell through the cracks. So Voice Found was there, making sure people didn't fall through the cracks.
No. And we had, lots of appointments, lots of phone calls, lots of laughs. It was really a lighthearted place where people could come and feel safe and welcome. And
I've learned a lot from you. Thank you so much. I really appreciate all the work that you do, and all your colleagues. Please extend my thanks to everybody, including Sarah. We love Sarah. We chatted with her earlier as well. We're going to meet the incredible Keith Eglai and Lucy Boudreau as well when we come back. Thank you so much.
Thank you.
Appreciate it.